This is Howard Dean, former governor of Vermont and DNC chairman, John Sheils, senior vice president of the Lewin Group, and our guest host this morning is Congressman Paul Ryan. Good to see you, gentlemen. And Governor, I'll start with you because earlier we've had so much talk today and over the weeks about what this public plan would mean. And Becky and Carl, we all are trying to get to the truth here. And we're told on one side that you'll be able to keep your own plan if you like it in the private insurers. And we've got Congressman Ryan giving us 4 reasons why there's no way a private company could compete against a public plan.
Well, look, it's not our intention to put private health insurers out of business. It is our intention to get private health insurers to behave themselves. The private health insurance market has failed in this country over the last 30 years. They haven't controlled costs. We're losing jobs not just to China but to Canada, because their businesses don't have to pay for health care, and our costs go up at 2.5 times the rate of inflation. So you have to have some kind of a public plan. Otherwise, you might as well not spend the $600 billion the CBO scored the House at. I was fascinated. Last year, we're going to have good weeks and bad weeks for those of us who want health care reform. Last week was a great week, not just because the House endorsed a public plan, a real reform package, and the Senate Health and Education, Labor and Pension Plan did, but because Harry and Louise endorsed a public plan, and most shockingly, the American Medical Association, one of the most conservative groups that's been in opposition to every single reform, including Medicare, that we've ever had, is in favor of the House bill. That was a stunner. We'll have good weeks and bad weeks again, but I think we're making some progress.
Mr. Sheils, you're a nonpartisan group. In your view, can they coexist, public and private?
Well, I think that they could coexist, but only if they play on a level playing field. What the public plan in the House bill would pay providers, hospitals and physicians, on the basis of what they now pay for Medicare services. And that's about 20 to 30% less than what private insurers have to pay for the same services. So there's a huge price advantage built into the public plan in the House bill. The Senate bill, the health bill from Kennedy's committee, would require the public plan to compete on a level playing field with the private sector. They'd have to use pretty much the same rates that everyone else has to use. And the impact of that will be very, very different. Under the Kennedy style, you'd probably get perhaps 20 million people in this public plan. Under the plan in the House bill, we think you get perhaps 100 million people in the public plan. And about 90 million of those people would be people who find themselves shifted from a public plan, from the private insurance they now have, to the public plan.
Does that jive with your numbers, Governor?
Yeah, I think that's right. I think it's a little high. I wouldn't agree that you'll get 100 million people in the public plan if the House bill passes. Look, there's plenty of room here for working this stuff out. As I said, I think the behavior of the private health insurance industry has been reprehensible over the last, particularly 15 years. Interesting, 15 years ago, most primary care physicians would not have supported a single payer. Today, most of them do. And it's not because Medicare's gotten better. It's because the conduct of the private health insurers has gotten so awful, both to providers and to patients. But I agree that you can't have an unequal playing field. And I actually think there should be a compromise in the rates somewhere so that you do have pretty much a uniform payment scale.
That doesn't sound so bad, Congressman.
Well, look, I'm looking at John Sheils' numbers right here. 122.9 million people in the public plan in 3 years, 113 million coming from private health insurance. Governor, let me ask you this question. Assuming that these actuarial estimates are right, and there are other actuarial firms like Lewin and others that have basically said the public plan crowds out the private sector. If that does happen, and if the public plan does displace and crowd out the private sector, are you comfortable with that?
There's no evidence that it will happen, Paul.
Well,
the fact is that the CBO believes that the plan that was passed in the House adds only 5 million people to the public plan. Yeah. So there's very wide-ranging estimates. And look, there is no system in the world, in the Western world, that doesn't have some sort of private health insurance. Even Britain, which is the most government-oriented system in the Western world, has 15% of it in private dollars. Well, and other systems in Europe have more. So I don't think, I think the American people, this is about whether the American people get to choose or whether Congress people and insurance companies get to choose.
Let me ask you this.
We think the American people should get the choice of a public or private plan, and it's up to us to write those plans so that they're fair.
Yeah, so the question is, if we give them, quote unquote, a choice, and the choice they only end up with is just the public plan, then that really isn't choice. Here's a quick question. Let me ask you this quick question. So the CBO, I've been looking into their numbers. They basically have two foundational premises, which is, number one, cost shifting really isn't that significant. It doesn't really occur. Doctors and hospitals don't overcharge the private sector because they're underpaid by Medicare and Medicaid. That's premise number one. Premise number two is employers will always be focused on competing for work, not on watching the bottom line. Therefore, they'll never shift their people over to a public plan because it will not be in the interest of their employees. But if we define that the insurance they have to buy in the private sector is actuarially identical to the public plan that in this national exchange, why wouldn't they push their people into the public plan if they could cap their losses or their expenses at 8% indexed at inflation instead of the unpredictable price of health inflation, which is about 3 times the rate of the regular inflation, by sticking with the private sector? John, you care to elaborate on that?
Well, I think that the thing to understand is that if the public plan succeeds in putting together a program at a lower cost, we think maybe 20 to 25% lower, a lot of employers are going to feel and want to take advantage of that opportunity, move into the public plan so that they can enjoy those savings. Some employers, I think, are going to feel compelled to go in because if their competitors go in, they'll be operating at a cost advantage relative to you, and you'll lose out. So the incentive here, it will be to get people into these lower cost plans. The way it works is that the employer would make a decision to stop their health plan and to move people into something called an exchange, which is a kind of a supermarket for insurance products. And people would have a choice of products. Some of them would be private options, and then there'd be the public option. So it's true that a person could lose their employer coverage. The employer could decide to stop that plan. But once you get into the exchange, you do have the opportunity to pick some private insurance. We think that the difference in price is so great that we'd actually see about most of those people taking the public option.
Yeah, even CBO is saying the public option is going to be at least 10% lower than the private sector inside of the exchange.
Well, let me just add something to that, though. Isn't that what this is about? Doesn't that then require private health insurers to reduce their costs? Let's look at what goes into the cost of private health insurance. It's, of course, what you pay the doctors in the hospitals. But on the private side, it's return on equity. It's huge CEO salaries, in the $20 million range in the 3 largest healthcare companies in the country. It's advertising. It's bureaucratic inefficiency. The fact of the matter is, when I was governor, we essentially privatized the administration of Medicaid for 3 years. And we had, at the end of the 3 years, we had to take it back ourselves because it cost us 3 times as much for a nonprofit private insurer to administer the costs as it did us. So maybe I think one of the reasons the president wants this public option is to squeeze the inefficiencies out of the private health care system.
Sure, but Governor, CBO is telling us this doesn't address health inflation. You've been very outspoken on that, and I want to compliment you on that. But this doesn't address health inflation. According to the CBO, the expenses of the public plan go up 8% a year. That's a lot more than even Medicare and Medicaid grow. So what the CBO is telling us is we're creating a huge new unfunded liability that even if this thing's paid for in the first 10 years, after that, massive new unpaid-for entitlement on top of all the other ones we've already got, and it won't address health inflation. It will grow at about 8% a year, which is a lot faster than even these other programs are growing at. So, I worry that we're not actually addressing the root cause of part of the problem here, which is health inflation, which you and I really want to tackle, and this bill, I don't think, is tackling it.
Well, I think this bill does fall somewhat short, although I don't think it's going to go up at 8% a year. Historically, the private sector has done much worse in controlling health care costs than the public sector is. Now, you can say that's because of arbitrary payments to physicians or whatever the reason is, but that's just the fact. Now, I do believe that this bill could go further controlling costs. However, I also believe, given the history of health care reform, that we've tried to control costs for years. The private sector has totally failed to do that over the last 35 years. So I think the only way to get this done is to have everybody in the system. Only if you have everybody with health insurance can you, I think, have any shot at making the reforms in the public plan that will, in fact, control costs.
That was no yelling. That was very good. I just wish we had more time.
That's because the Congressman is a great host.
I don't like to yell at people.
Yeah.
No, I learned a lot from that conversation. We'll have all 3 of you back to talk about that again.
Thank you.
Gentlemen, thank you. We appreciate it.
Thank you.